So second last, let's talk about the PaCO2. So in this example, what I'm going to do is I'm just going to double the PaCO2. So the assumption is here that either CO2 production has gone up, meaning that your tissues are producing more CO2 and you're just not clearing it, or you have reduced your respiratory rate, so you're just not clearing it. So what's being made isn't being breathed off. So if we were to double it, it would be 80 millimeters of mercury, and we divide it by 0.8, it equals 100 millimeters of mercury. That first part of our equation equals about 150 millimeters of mercury, so you minus your 100. So our PaCO2, just with a doubling of the CO2, has halved our PaO2. So the CO2 has actually taken up space in the alveoli. And I'll explain why in a minute when we talk about the respiratory quotient, because obviously we're talking here about the arterial CO2. The respiratory quotient is a ratio, and it's CO2 produced to oxygen consumed. And it actually represents at the cellular level. And respiratory exchange ratio is the exchange of CO2 produced with oxygen consumed at the level of the alveolus, or at the level of the mouth is where it's measured. So respiratory quotient and respiratory exchange ratio are actually the same when they're steady state. So when the amount of CO2 produced is constant and the oxygen consumed is constant, they will equal each other. So for the sake of just saving a bit of time, I'm just going to talk about respiratory quotient. And respiratory quotient is affected by the fuel that your cells use. So if your cells were to use just glucose, the respiratory quotient would be 1.0, meaning that for every CO2 produced, 1 oxygen is consumed. So it's an equal ratio. And then for protein, it's 0.8. And then for fats, it's 0.7. And before I said a Western diet is 0.8, and it's not because the Western diet is full of protein and we're all bodybuilders and able to have huge muscles or anything like that. It's actually because the Western diet's mostly made up of glucose and fats. So it's around 0.8 is what it equals out to. So I'm just going to put in the example someone or cells that are only using glucose as an energy source. And if we work our way through the equation, so the first part of the equation with our oxygen, partial pressure atmosphere, and partial pressure or vapor pressure equals about 150. So then you just minus 40 because the ratio is just 1.0. So 40 divided by 1, it equals about 110 millimeters of mercury. So an all glucose diet would essentially lead to technically a increased PaO2 in the alveolus. Now let's change it to a diet that's completely just fats. And if we were to work our way through the equation, the PaO2 would equal 93 millimeters of mercury. And so just to reiterate the point, the respiratory quotient, although it represents the cellular level, it's equal to the respiratory exchange ratio as long as everything is at steady state. And the respiratory exchange ratio is showing us, how much CO2 is coming out of the blood versus oxygen going into the blood. And that's why that ratio is important here in this part of the equation.